Hello, my name is Gagandeep Kaur Uppal and my student ID is 142772219 and we are three members from group 9. Today we will discuss about community assessment and development project. Next, Navjot.
My name is Surinder Kaur and my student ID is 164327251 and we are three members.
Okay, hi, this is Navjot Kaur from Sanika College of Nursing. And today as a group, we are going to present our topic that is community assessment. And I would like to tell Gagan to start the topic.
Yeah. Firstly, introduction. The community chosen for this assessment is adults living with cardiovascular chronic diseases in Toronto, Ontario. Cardiovascular disease is one of the four main non-communicable diseases. Nearly 2.3 million Canadians are living with cardiovascular disease. Cardiovascular disease are the second leading cause of death in Canada. And this data shows the need to analyze the population affected by cardiovascular diseases to implement public health strategies to mitigate the spread of the disease. Next, risk factors. There are several factors that increase the risk of cardiovascular diseases in the Canadian population, and that is smoking, sedentary lifestyle, physical inactivity, unhealthy eating habits. So, smoking leads to the formation of plaque in the blood vessels or the thickening of the blood vessels, forming blood clots in the blood vessels, which leads to cardiovascular diseases. According to a population by the Government of Canada, more than half of Canadian youth have a sedentary lifestyle characterized by many hours sitting down. Next is why I choose this community. Cases of cardiovascular diseases have gradually increased in Canada despite the health interventions set up by World Health Organization. So, according to the globally percentage of cardiovascular diseases, approximately 10% of men and 7% of women have CVD. The older population is most affected by CVD, with approximately 25% of adults aged 65 and above living with CVD. Individuals with CVD need resources to support them, reduce risk factors, and reducing the symptoms of the disease. Next is community assessment. So there are two models are used, CHAINS and MAM model. The community health assessment and group evaluation is a public health assessment model recommended by the CDC that aims at helping communities develop an action plan on areas that need change. This model involves individuals influencing or influenced by the community and community members to survey the community structures, hence make interventions. Mobilizing for actions through planning and partnership will also be used in the assessment. So change is an appropriate model since it is intensive and critically analyzes issues affecting the community. It involves an step plan. MAP model will also be used alongside the change model to ensure that the data gathered will help create substantial changes in the community. So next change will describe by Gurinder Kaur.
Hello, Professor. So there are two models. First is change model and second is map model. Firstly, I will describe change model. So change model we use in a community assessment. There are 8 steps in this model. Firstly, we assemble a team of community members. Then we plan a strategy or develop a strategy. After that, we review the change session. Then we select or gather data. After that, gathering data, we review that data, then ensure that gathering data. After that, we develop an action plan. So basically, in this, we make a plan, strategy, and action plan. The next is MAP model. It is also used in a community assessment with the partnership of various community organizations. The main motive, this model involves conducting research on community member and make developing strategies to achieve the final step. In this model, there is a important to identify the resources that will meet the criteria of community people. Continuing further, MAP involves six comprehensive phases. First, there is a partnership with the organization team through which we can work together. Vision, then we select our vision and value statement. After that, we perform 4 assessment. Firstly, we assess the theme and the strength of the community. Then we assess the health, public health. After that, we check the status of community. After that, assessment of forces of changes. And the next step is then we identify the issues, strategic issue. Then we coming up with the strategies to overcome that issues. And after that, we implement that strategies into our plan. Uh, Next is case control studies. In this method, we will use assessment by studying a sample population. We select a sample population, a small people of group, then we do case control study over that people. For example, a population will CVD will live on a vegetable-based diet to track the prevalence of the disease symptoms, while the other sample will live by the normal diet. So we select a small people, then we do case control studies. After that is collecting community data and through change and map model, or it is a type of tool where team members collect primary data through surveys, interviews, and direct observation. And primary data will help in obtaining first-hand data, for example, direct interaction with the people. And secondary data will also used for assessment, for example, CDC and reports. Continue further. The team will visit local community members and organization and healthcare center to collect the primary data and compare the data with the previous secondary data to evaluate the community health. So next is community strength and challenges. The major strength that will aid in the community assessment is the population is welcoming to new healthcare policies. Individuals who are willing to participate in the interviews and surveys and accommodate lifestyle changes. And some of the challenges facing Ontario population living with CVD are sedentary lifestyle, physical inactivity, and lack of sufficient fund. So the Ontario people who are facing health problem mainly due to the sedentary lifestyle. So thank you. Next of the part will be covered by my next group member, Navjot.
Okay, thank you, Gurinder. I'm going to continue with the rest of the topic. So here my topic in which I'm going to discuss about organizations available in the community. As we all know, there are certain set of organizations along with whom we have to work in a coordination. The team can partner with Ontario provincial government to fund the assessments. These organizations often include churches, unions, healthcare agencies, social service groups, and clubs. And during their data collection, the team has to assess the public healthcare facilities to study the health patterns of the population. There's also government such as Ontario Health Teams, Health Quality, and Ontario and non-profit organizations such as Ontario Chronic Disease Prevention Alliance. These are certain set of organizations available in the community. With them, we have to work for the betterment of the community members so that we can collect data accurately from them. Next slide, please. Okay, the next part here I am going to cover is stakeholders. So as we all know, the stakeholders plays an important role in anything. So here the community stakeholders include house heads, parents, business owners, community workers, and we all know that nothing can happen perfectly without stakeholders. So firstly, the team can seek a partnership with the Ontario government, then with the community stakeholders. The assessment's objective is to reduce CVD cases in Ontario, which will also lessen the economic burden on Ontario government's funding. So therefore, the team can hold a meeting with the Ontario government officials and propose a partnership with them. Then only they can able to know the root causes of all the problems of community. They can able to assess all the data accurately and appropriately, as they can collect the data, as my friend already told, through surveys or through questionnaire or through direct visits. Next slide, please. So I'm going to continue with this. The team will also work with organizations such as the developmental organizations, environmental organizations, and social organizations. Let's suppose if one is working with these kind of organizations, they can able to know about the sanitation programs. They can able to know the problems arising due to sanitation, due to social gatherings, or due to other societies. They may able to know the accurate cause of any problem. The organization will partner or volunteer resources to a team. The team will partner with the local communities to gather data and analyze it while recommending solutions to reduce CVD cases. As they all gather at a particular places, and they may collaborate with them to gather accurate information from them. Next slide, please. Okay, next is engaging the community. So as we all know, while we are collecting something about community, we have to show our engagement with the community. So during the beginning of the assessments, the team will start by collecting primary data, and we can only collect primary data by doing visual assessments or physical examination kind of things. And also we can visit door to door to collect data. We can hold group meetings, we can hold surveys, we can hold interviews, so that we can do something better for the community, and we can able to come to know that what are the causes behind every disease, or we can also find out the ways to prevent those diseases. Next, please. Hello, Gagan. Okay, the last most important step is ethical considerations. As we all know, while about our ethics, that how we have to deal with patients. We are either we are working in community settings or in healthcare settings. We have to consider our ethics. Since the team will rely heavily on collecting primary data, the team should ensure to gain informed consent before collecting data from community members. As we all know, informed consent is one of the basic and the most important step while we are delivering care to the client. Procedures or non-invasive procedures, we have to respect their consent. We have to take those first. And the team will also consider individuals to be a part of the assessment. They can motivate their clients to be a part of their assessments. They can educate them. But before indwelling any kind of assessment or before doing any kind of procedures, they just need to consider their ethics and to take informed consent from them. So this was all about our presentation. So next, here are the references from which we had taken our data. So this was all about our presentation. Thank you so much. And thank you group members for taking part in group presentation.